Welcome back to Great Gym. Today we're talking spine health, and what we're actually going to talk about is this pelvic tilt stuff that I'd really like it if our industry stopped doing. Anterior pelvic tilt is more of a tilted down pelvis like this, and it leads to, can lead to some back issues. Posterior pelvic tilt is where it goes the opposite way, more like that. And how this would look from the profile would be that you have a hip that goes like that, your lower back is hyper extended, your upper back is up here, your head is up here, your shoulders are right there, or that's your neck, and then your head is up here. Femur, tib, fib, and ankle. How's that look? It looks like a pregnant person. Anyway, for posterior pelvic tilt, we're doing the opposite. Usually you're going to have a flatter spine, you're going to have an upper back, thoracic spine up there, cervical spine. That person has a tiny head. And then you've got femur, tib, fib, ankle. So what I'm saying is that I don't think these are necessarily appropriate for everybody to push them if there's ranges, right? So some people are going to sit more towards this, most people are actually going to sit more towards that anterior pelvic tilt, and you're trying to iron that out slightly so that they can get in a better position to do their workout from, and then hopefully they can stay in a better position throughout the day so that they have less risk of injury and they're getting more from their workout in general. Same thing with this, only opposite. But what I'm saying is some people actually deal better with a slight anterior pelvic tilt. I'm one of those people, for instance, and most of the people that I've worked with that have spine issues are. The problem that really happens with the spine is when there's too much movement at that lower back area. It's that portion of your spine isn't designed to rotate hardly at all. It needs to remain very stable, and it's also not designed to go into repeated flexion and repeated extension. Not to say that flexion and extension at the lower back is always an inappropriate thing, but sometimes, most of the time, I would say with the people that I've worked with, it doesn't lead to good things. So what is optimal pelvic tilt? Optimal pelvic tilt is wherever your tilt sits that reacts the best with your spine. So if I feel my lower back muscles while I'm in too much of an anterior tilt, my lower back muscles are going to feel really taut. They're going to feel really tense because they're having to do a job that they're not supposed to be doing at that time. Now, if I kind of play around with my pelvic tilt and I kind of twist, or twist isn't the right word, but I kind of play around with it and I move it slightly while I'm holding onto my lower back, whenever those muscles stop feeling that super tension, like right here, where I have a slight anterior tilt, you can tell by my waistline, then that's my optimal tilt. And then we want to ingrain that as the position that we want to move from. So from there, we would hold on to this, we'd find that position, and then we'd go out into a squat stance, and then we'd put one hand on the front, one hand on the back to maintain this position throughout. And as you go down, they're going to kick on, that's fine. The tilt is what we want to remain constant. So we're going to hold here, and we're going to sink into that squat. I'm only going to get to about right there before mine starts to give way, and then I'm going to come back up. And what we're trying to do is that we're going to repeat that a few times, holding it down at the bottom. What we're trying to do is ingrain that pattern so that we hold this in that position when we go to do other movements and our everyday lives. The point is to be able to hold this in position while we do all these other movements to create a stable spine so that we're less likely to gain an injury so that we can live our lives the way we want to be experiencing them.